Well, I'm Chris Cannon here with Peter Block at AHA09 with a roundup of the NCDR highlights.
You're right, Chris. You know, the NCDR registry is split up into a number of sub-registries. I always forget them, but the highlights of these presentations are really from the cath-PCI, the ICD registry, the Action or Get with the Guidelines registry, and the IC3, which has also been renamed.
Yeah, the Pinnacle registry
There
now.
you go. So cath-PCI has the first, Chris. Why don't you take that one?
Well, an interesting look within the cath-PCI at patients on dialysis at getting antithrombotic agents that are cleared renally. And needless to say, those who are given, for example, an eptifibatide, a 2B3 inhibitor, or enoxaparin who are on dialysis will have bleeding, and they were seen in this registry to have these medication errors. So something that can be focused on as a quality improvement initiatives going forward.
Yeah, it's real documentation of real errors, and it is not a good thing, but not surprising, patients that got the anticoagulants on dialysis did not do as well. So we have some documentation of this interesting stuff, which may actually be helped by the electronic medical record flagging things and saying, whoa, wait a minute.
Yeah.
So important data. The ICD registry and the Action Get with a Guideline registry, sort of two interesting bits of information. Perhaps no surprise that in the ICD registry, lead dislodgement is less common if an electrophysiologist puts in your leads. You know, I'm not exactly sure what to do about that, but that's the information, and there you have it. The Get with the Guideline.
There, I think the short answer is to ask and see who is proposing to put in a pacemaker. And there was another publication earlier that complications are fewer in people who do more procedures.
No surprise. The Get with the Guidelines business, also an interesting bit of information. The door-to-door time, this business of somebody coming into a hospital needs to be transferred quickly. How long does it take you to get that patient out? You'd like to do it within 30 minutes. Turns out that really is a rare event. So a lot of time lost, now documented in patients who don't go directly to hospitals that have PCI opportunity. An interesting issue. We'll see how that works out. It needs to be fixed.
Yeah, and fortunately, the Action Registry Get with the Guidelines is partnering now with Mission Lifeline, the AHA program, to try and improve STEMI systems of care. This is the community hospital initiative to speed up the door-in, door-out times. And so this will now become a baseline metric that we can try and improve on.
And the last one is the clopidogrel issue.
Obviously something that has been in the focus in drug-eluting stented patients of not wanting to have patients stop prematurely. Very few data are available in clinical practice other than prescription refill data. So now from the IC3 or Pinnacle Network, some initial data on compliance.
Yeah, the compliance is not really so terrific. 60% only compliance with Plavix. So again, lots of work to do, and we need to talk to our patients a little bit better.
And this, I think, is an opportunity in the outpatient setting now to try and work with hard data and do some quality improvement initiatives that will likely improve the outcomes for our patients.
So lots to be learned from the NCDR registry here in Orlando. And I'm Peter Block with Chris Cannon. A wrap-up for today.